If a patient is diagnosed with stage 4 breast cancer, which means it's gone elsewhere in the body, one of the questions that I'm asked is, what are my treatment options? Let me explain. What are the treatment options for stage 4 breast cancer? Well, stage 4 breast cancer, cancer elsewhere in the body, what are those other places that it can be? It can be in the bones, it can be in the lungs, it can be in the liver, it can be in the brain. The treatment of stage 4 breast cancer depends on a multitude of things. Where is it elsewhere in the body? What have we done already to the treatment of the breast? Have we treated the breast or not? And there's a lot of debate. If you present as stage 4 breast cancer, do we need to treat the cancer in the breast itself? A lot of debate about this. So one of the things that patients say to me, gee, Dr. Harness, am I going to die with stage 4 breast cancer? The honest answer to that question is that at least today, stage 4 breast cancer is not curable, but it is certainly treatable. And I have had in my career stage 4 breast cancer patients live for years. It depends a lot on where the location is. One of the easier locations to treat is when the cancer is in the bones. Often it means an ongoing anti-hormonal therapy plus some form potentially of ongoing chemotherapy as an example. If it's isolated in the liver, we may not only also do chemotherapy, but we could potentially have a technique where we could ablate, put a needle into the tumor in the liver and literally cook it, if you will, inside the liver. I mean, that's one of the options. One of the really difficult places to treat stage 4 breast cancer is when it involves the brain. Typically what we want to do then is to remove the bulk of the tumor and then use some form of radiation therapy. So the treatment of stage 4 breast cancer is really variable. But again, it's not something that's typically not treatable. It is treatable. It may just simply not be curable. So therefore, it's really important that you're working with a multidisciplinary team that's really right up to date on what the latest and greatest treatments are, no matter what your stage, including stage 4.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.